Thank you for joining us. Hi, this is Dr. Scot Hutchison here in Tucson, Arizona. Thanks for joining us for Hutchison's Huddle. And today, this session is about male factor infertility, which we have really given short shrift to in the past. And we're going to try to make that up because it's a gigantic issue. So to kind of give you the overview, so about at least 40 or so percent. In our practice, we tend to see more about 50-50 between male and female as far as the potential causes for not getting pregnant. So the whole idea that you can just have normal looking sperm and be perfectly fertile is really incorrect. And so we're going to talk about that as well. But let's back up a little bit. Oh, and before I forget, so on our Facebook page, please go back. You can look at our other educational programs for patients and see conversations that I've had with some really fine OBGYN physicians like Dr. Aaron Sperry and Dr. Celia Valenzuela, Dr. Kevin Murphy, Dr. Alina Lackenpaul. All of these sessions are, I think, really worthwhile looking at again, and they have very interesting topics. And tune in 2 days on Thursday, the 26th, we're going to be talking about polycystic ovary syndrome because this is Polycystic Syndrome Awareness Month, if you didn't know that already. But so we're gonna go over polycystic ovary syndrome and how best to treat that. And how to manage the repercussions for health that it tends to cause people in the future. Also, if you're here in the Tucson area or you're close by and you would like to come to our family fiesta party, we are having that on Sunday, October 13th, and it's from 10 a.m. to 2 p.m. and it's going to be at Reed Park here in Tucson, and you will have and there will be food trucks, and I'm going to break week, and we're going to have shaved ice, which has sugar in it, but we're going to make it okay for this one day, and face painting and little arts things for kids and stuff like that. So if you would like to come to our family fiesta, please do register through the Facebook page or online at, here you go, you can see the maybe can't this down here. So it's https://2019 RHC Family Fiesta .eventbrite, so eventbrite.com. So 2019 RHC Family Fiesta .eventbrite.com. Anyway, so let's talk about male factor in sperm. So so there had been all kinds of conjecture about why it was necessary for women to have sex with men to get pregnant and have children, many years ago. In 1677, a scientist named Antony van Leeuwenhoek figured out how to make the first accurate microscope. And it was a little tiny thing, and it was a little glass ball sandwiched between two brass plates. It looked like some kind of like craftsman tool. He was actually a craftsman. So, and then there was a little screw that adjusted a little pin up and down that you could focus into, you could put in the way of the lens. And on that pin, you could put different things. And then you could shine a bright light like the sun through that glass lens and adjust that little pin up to where you were just, you were magnifying what was on that little pin. And so he was first able to identify human red blood cells. He identified organisms in pond water. And then one day in 1677, he, had his wife help him, but they had intercourse, and he collected some seminal fluid from her, put it on that pin, and then wrote to the Royal Society in London that within 6 beats of his heart, he had gotten that sample up into the sunlight and he was able to identify sperm. So I don't know whether he was jumping out of bed and there's this naked dude out on his porch with looking, but regardless, he was able to see the first sperm. He was able to actually draw very accurate pictures of them. And so he submitted that, and that was published in 1677. He had the theory, like a lot of other people, that, in that male-centered universe, that the sperm were responsible for the whole baby, and the egg, which, other scientists have figured out there were eggs from mammals, and the uterus just helped nurture it. So everything was very chauvinistic, but that it took, another 200-300 years for that to be disproved. But anyway, but people could see sperm then. Accurate semen analysis started before 1900. So if you can kind of wrap your mind around that, when people finally had fairly modern type microscopes, they were able to actually quantify pretty well the amount of sperm that are in seminal fluid. And they were able to actually codify, like, what is a normal semen analysis. So and let's talk about those numbers. So World Health Organization, I mean, there's a little bit of controversy, but it's somewhere about between 50, so the volume should be 2.0 milliliters or cubic centimeters or more. The count should be 15 to 20 million sperm per milliliter or more. And the motility, or the percentage of the sperm that are moving, should be 50%, 50 or more. And then over time, people said, not all these guys are fertile that have 50% motile. What could be different? And so other categories kind of came along. Some andrologists or people who study sperm said, well, why don't we look at the amount of sperm that are moving really quickly, because these are little tiny cells, and they've got to make it through a lot of reproductive tract to get through to the egg, and they got to do it pretty quickly. So how many sperm do you need to be moving quickly? Well, it turns out somewhere around 25-30% of the sperm should be moving in a pretty brisk pace in a straight line. And then in South Africa, long ago, a woman named Dolores Kruger said, hey, I want to know the percentage of the sperm that have to look really normal so that we can say, hey, you don't have to do IVF, you're in good shape. You've got enough of these really good-looking normal sperm that you are going to be able to get pregnant with either intercourse or with just putting the sperm in the uterus, which is called intrauterine insemination. And so she devised this paradigm. She looked at the numbers that they had and came up with, I think it was 6% had to be normal. The problem is that humans are fallible, and machines have tried to do this sperm morphology thing, and it just is still a little bit too difficult. I'm sure over time it will the machines will do way better than we do. But for right now, it's humans doing the judging, and it's subjective, and like all things, people get better at time with it. So if you out there or me, if we were to, like, I haven't done semen analysis for a long time, but if I looked at the standards again and then got in the lab, I would probably do a pretty reasonable job of judging sperm. Then over time, as I got better and better at it, I would become a harsher and harsher critic. And so then the numbers tend to be worse. So pretty soon there's this downward drift in doing strict morphology standards to where nobody has normal sperm. So it'll be like 0% normal forms. Well, the problem is that when it's 0% normal forms, you'll still have people who are getting pregnant with inseminations, and they shouldn't be. So it's sort of an invalid, that marker is relatively invalid. So what has happened to sperm over time? Well, before 1900, the average sperm count was well over 100 million per milliliter. By 1973, that had fallen to 99 million per milliliter. By 2011, it had fallen to 47 million per milliliter. So this is disturbing, and coupled with this is the overall decline in birth rate around the world in developing countries, and even in developing countries, or in developed and developing countries. So birth rates are now so low that in many places in the world, fertility treatment is like a standard, government benefit that you get. For example, in Japan, they have about half the population that we do, and they're doing over double the number of IVF cycles that we do. They are desperate to try to replenish their population. And then in places like Arabia, I have a friend who's a professor, had been visiting, and I think it was in United Arab Emirates, she said, where she saw these big billboards calling for men to go in and get semen analysis, because they're so concerned. There's such a growing epidemic of male factor infertility that they really want guys to go in and get tested and get a heads up long before they're ever even ready to have kids. So so there is this big epidemic around the world of male factor infertility, and sperm numbers seem to be heading lower and lower. So the big question is, why is that going on? And there's a number of factors that are really thought to be up at the top. The first is the relationship of environmental chemicals and the endocrine system. So we know that everybody, so Centers for Disease Control says everybody in the United States now has measurable levels of these chemicals called phthalates, which are plasticizers like bisphosphate or BPA, which I'll have to look up, sorry, but you know what BPA is. It makes plastic bottles softer. The chemical industry has been very, very tricksy about this, because everybody has said now BPA is bad, and that it acts like an estrogen, and that it disrupts proper signaling in the body. But they just make other ones that are very similar to it, and then put those in the plastics to make them softer and less brittle. So virtually everything, the dairy farmers have the tubing that the milk is going through that has BPA in it. All of these processed foods, all of the yogurts, all of the cheeses, except if they're organic, maybe they don't have that. But all of these foods that are processed are going to acquire these endocrine disruptors at some point. So obviously, if you're a male and you need your testosterone to help you foster sperm production, and you're getting through your diet lots of an estrogen, it's going to be a problem. So that's one area of that. The other thing, and it's really mediated almost the same way, is that when men gain weight, and certainly men have gained a whole lot of weight just like women. I mean, if you look at the general population, most people now are overweight or obese. The adipose tissue the adipose tissue that we have makes estrogen. So it is adipose tissue by itself is this huge endocrine organ. So, and if you're male and you're making lots of estrogen, it's not really helpful. We'll talk about this again, in a couple of days on the polycystic ovary syndrome thing. But, both males and females make each other's hormones in smaller amounts. So if you're female and you're starting to make lots and lots of androgen, it's not good for ovulation. And if you're a male and you're making lots of estrogen, it's not good for your sperm production. So, but other things are out there too. There are other kinds of chemicals, mainly chemicals and medications, that can also push sperm production down. So for example, you all have heard of the opioid epidemic. These fairly evil companies getting out there and overly promoting narcotics as pain relief. And keep in mind, by the way, I just got to say, look at the VA study, the randomized VA study that looked at knee pain and back pain and opioid use, or randomizing these two large groups of people, thousands of people, into either opioids or non-steroidals. And even in the beginning, the pain control was better with the non-steroidals. Over time, the narcotic group was so much more worse. So it didn't even do any good. And we've sickened and killed all these people. And I don't know how we're losing 50,000 people a year to all that. Honestly, I hope there's a special place in hell for those folks in those companies. But anyway, so the narcotics also, we have a fair amount of people who are narcotic addicted, and that will push sperm production down as well. So other bodily function can do well, but we tend to see lower sperm production with opioids, for example. Uncontrolled diabetes in guys will push sperm production down. So if you're a pre-diabetic even, man, you want to get that under control, because that's really gonna hurt your sperm production and the sperm function. Other medications, we see tons of supplemental testosterone use. Like I talked to a guy today who had used both supplemental testosterone and was narcotic addicted. The prescribing habits of some of these doctors is just really super questionable. But supplemental testosterone, and they'll call it T. So and here in Tucson, there's all these radio ads. Hey, do you have low T? Or do you feel tired? Like, who doesn't feel tired sometimes? Or do you have trouble with performance? Like, if you're a normal dude, who doesn't have trouble with performance once in a while? Honestly, but then they'll start them on these large amounts of supplemental testosterone that will drive their own testosterone production and their own follicle stimulating hormone production into the basement, and then they will not make sperm. So, and the sad thing is that if you talk to some of the medical endocrine people who know more about it than I do, supplemental testosterone for about 3 years will pretty much render you agonadal. You will not be able to make testosterone on your own. So if you are taking supplemental testosterone, please rethink that. Go talk to the doctor. Certainly, if you're trying to get pregnant, you need to, or have your partner get pregnant. Please go and tell them, hey, I gotta have sperm, and at a minimum, you might want to bank sperm before you start the supplemental testosterone use, and bank a lot of it, because you may not be getting a lot of it back. And testosterone, has a place. And there are guys who, due to a number of factors, whether it's neurosurgery or, for just unknown reasons, are just not going to be able to make testosterone on their own, and their quality of life is really, really poor. Those guys really do need supplemental testosterone. But if you can also get them to make their own testosterone without having to just give them testosterone, then that will typically allow them to make sperm in a much more efficient fashion. So using anti-estrogen drugs like anastrozole or letrozole, or human chorionic gonadotropin to help them kind of try to make their own sperm, that can many times be much, much better, for at least for the short term, for when people want a family built. So anabolic steroids, another class of androgen-like drugs. They don't have as much androgen. They don't tend to, make people hairy or whatever, but they tend to make the muscle cells be able to make muscle much more efficiently. So starting in the 1960s, scientists, I think it was 50s, 60s, had figured out how to make anabolic steroids. So steroids that would cause more muscle development without creating a more testosterone-like effect with like hair growth and stuff like that. And those drugs were initially really developed for people who had wasting diseases or were really elderly and were really getting weak. And you could just give those to them, and man, maybe grandma or grandpa would be able to get up out of their chair and be able to go to the bathroom. But of course, like everything, people kind of find different uses for it. And so that started to be used by athletes and bodybuilders. And that's all peachy, but there are some ramifications for that for sperm counts down the road. And then I'm getting some questions. Let me try to answer these. But I'll get to that in a second. Other things that can interfere with sperm development: heavy metals. So heavy metal exposure. So if you're welding and you're not wearing a respirator, if you're taking bodybuilding supplements like protein supplements, a lot of these supplements have been processed in these factories where they're exposed to a lot of welds in the tanks and the tubing that carry the protein powder. So Consumer Reports years ago reported that in large doses you could get heavy metal poisoning from some of these protein powders. So I would encourage you really to steer clear of those. If you need extra protein, if you're lifting or you're trying to get stronger, get it through like organic egg whites or organic chicken, whole food sources, fish. But organic egg whites are a complete protein, and they will help you make muscle a little bit more efficiently than other proteins. But again, I would go strict organic on that as much as you can, and for the rest of your food as well, because pesticides also seem to really affect sperm production in a big way. So steer clear of those pesticides. I would also steer clear of Roundup or glyphosate. Why we're even selling that here in this country, European Union, called it a probable carcinogen, and I don't even think they sell it over there anymore. Here, you go to Lowe's and there's pallets of it sitting out there in plain view, and you can even smell it. It's, just steer clear of that stuff. The other, but along those lines, toxin exposure. So we're humans. I remember this old quote that this very famous psychiatrist at the University of Kansas had said, which was, men are always searching for, and this is paraphrasing a little bit, men are always searching for something to escape the intolerable grip of reality. And so people have been drinking alcohol for thousands of years. I saw something in the paper the other day that some of the first brewing devices were recently uncovered in China, and they could tell that they were used for brewing kind of a beer. But so alcohol in large amounts does pull sperm production down. I would encourage you. I think that the data, there's a bunch of literature from 2012 to the present that shows that alcohol, even in small amounts for both males and females, really does decrease fertility. So I would encourage you to abstain from alcohol, for at least 2 to 3 months, but more like 3 to 6 months prior to even trying to get pregnant. Certainly before IVF cycles, we like everybody off of all substances for at least 2 to 3 months. That's about how long it takes to make a sperm. That's about how long it takes to get an egg into that final recruitment process. So we really want them to be free of those toxins, at that time. Now, a lot of you will say, well, gosh, I smoked like a pack a day for 10 years, or I smoked pot like a banshee when I was in high school. Is it going to hurt things now? And the answer is probably not. But I would encourage you to get off of marijuana, definitely get off of vaping. You probably have heard about all the hue and cry about the most recent deaths from vaping. Some of that is really thorny because it seems like a lot of those individuals were putting different things than what they were being sold in the vaping juice, into the vaping juice. I don't know. All I can tell you is it's probably never a good idea to vaporize oils and stick them in your lungs. I mean, I think most likely there will be a big wave of interstitial lung disease, kind of the way, people figured out, hey, coal mining is associated with black lung. So I would really steer clear of that for your sperm, at least in the short term anyway. Also, cigarette smoking causes a lot of sperm DNA fragmentation. So, sperm are really vulnerable to DNA fragmentation because they're so small that the sperm DNA has to be packaged in a different way than it normally is in the rest of the body. So like in the eggs and in the rest of the cells in our bodies, the DNA is wrapped around these structures called histones. Histones are very stable proteins that don't break apart very easily. In sperm, they're wrapped around these structures called desmosomes, and they are very fragile. So older sperm, meaning even days older are going to have more sperm DNA fragmentation, but also men who are smokers. So when the test for DNA sperm fragmentation came out a few years ago, we were using that technology a lot. And I finally got to the point where I was like, tell me something I don't know. Every time I send in a sample for a guy over 40, every time I send in a sample for a smoker, it always comes back with high fragmentation. So, I don't order it anymore, but I think it's worth paying attention to and understanding that that's what happens. But save yourself the $400 for the test and save yourself the money for stopping smoking and get off of that stuff, for a while before trying to get pregnant. So other stuff here. So then there's a question, what are the best vitamins or medications to boost sperm count? And along with exercise between age 25 and 30. Well, this goes for all ages. So it's not just between age 25 and 30. So first of all, moderate exercise really does help. It reduces oxidative stress in the body. It increases testosterone production. So moderate exercise, and how you would define that is kind of hard. I would tell you, I think most people say, don't go training for a marathon, and if you're already like a great runner, and you're like Bernard Lagat and you're super fit and you can, run 5-minute miles all day long, great, whatever. But if you're a mere mortal and you're going to say, oh, I'm not very fit right now, but I'm going to train for a marathon, don't do that. Instead, do some walking, maybe some body weight exercise like push-ups, like try to have a goal that you will do like 100 push-ups, every other day, or and sit-ups and squats or lunges, things like that. So you can do really good, short, high-intensity workouts. Most of us are pretty busy, and this whole idea of going to the gym and like hanging out for hours at a time, working out, is just not gonna fly. So, or not for very long. So I encourage people to do, sets of 50 lunges and do 3 or 4 of those in between doing like ball crunches or 100 of those, and then do a set of 50 push-ups and do, 3 or 4 of those, to where you're breathing kind of hard for about 15-20 minutes. That'll do the trick. I would stay off of bicycles, because bicycles, guys who, at least in the studies of guys who are riding for 5 hours or more a week, it's probably the heat that is pulling the sperm production down. Likewise with motorcycles, because, it's the same kind of gig. Your testes are kind of, smashed up against the trunk. They have to be about 3 degrees Fahrenheit cooler for that sperm DNA fragmentation to not occur. So I would stay off of motorcycles. We like you to avoid heat. So stay out of hot tubs, stay out of saunas for right now. And same with really hot baths. So, I can remember a case where we had a patient where the husband has a very stressful job. So his way to decompress was to get into this hot tub that was 104 degrees, and he would stay in it for an hour, and then he would get out and rejoin the family. And he had dirt for sperm. And when he stopped that, within 6 weeks, the spouse was pregnant again. So anyway, heat is really a problem for sperm. Boxers versus briefs don't seem to matter, but I would tilt you more towards boxers anyway, and more looser fitting clothing. Then, as far as other supplements, you want to increase your antioxidants. Now, I would recommend that you do it with just your food, because everybody in America wants to make a buck, and our federal government has no penalties for fraudulent supplement sales. So people can, for example, the Cornell Group bought a whole bunch of supplements at all these different places. I think it was CVS, Target, before CVS was part of Target, Walgreens, and Walmart. And Walmart's, their herbal supplements, 3% of them actually had the real herb by DNA analysis. So, there should be a penalty for that, but there's none. But long story short is just don't trust manufacturers. So I think what you should do is just eat your food. So eat your leafy greens, eat several servings of leafy greens and vegetables that are green or yellow every day, even leafy greens for breakfast. Berries like blackberries, raspberries, blueberries, if they're organic, eat a handful or two of those a day. Those are really good antioxidants. Dark chocolate, so the stuff that's like 70% cacao or higher, that's another really good antioxidant. I mean, go as low sugar as you can with it, but get those things into your diet. I mean, don't eat like a pound of chocolate a day, but like an ounce or two, I think is probably okay. I would, yeah. And then you want to stay away from processed foods. They take a lot of the antioxidants. They take a lot of the omega-3 fatty acids out of the foods. They take a lot of the inositol out of the foods, which helps with insulin signaling. So, eat your beans, eat your sardines, eat your salmon, eat those fatty fishes, shellfish 3 to 5 times a week. Eat your nuts, like a handful of tree nuts a day. So almonds, walnuts, pecans, that kind of thing, pistachios, macadamias, that's all good stuff too. And then decrease, eliminate your alcohol, eliminate marijuana, eliminate smoking, and eliminate processed food and junk food. There was a study out of Holland from a couple of years ago that you can look up where they randomized men into 2 groups. One group, they said, hey, eat snack food. So the equivalent of like Cool Ranch Doritos or Flamin' Hot Cheetos. The other group, they said, please stay away from that stuff. And they just followed their semen analyses over time. And you can just watch the guys with the snack food just plummet over time. So, I mean, stay away from those, those junk foods that are super addictive. They, God, I've had my problems with them over time. So I know what it is, but, don't have that stuff in your house. It's really bad for you. And then as far as medications, it's really hard to say that you really don't want to take any medications if you don't have to. But yeah, if you've got really hypogonadism and you're making hardly any testosterone and you're not making very good sperm, then seeing a urologist can really help, or medical endocrinologist that can really help with getting you to make your own sperm with the estrogen inhibitors or estrogen receptor blockers or inhibitors and human chorionic gonadotropin. So things like, again, anastrozole, letrozole, clomiphene for guys can sometimes be very, very helpful. And then the HCG, which is under the trade names of Novarel or Pregnil or that kind of thing. What else do we want to talk about? Oh, omega-3 fatty acids. So the omega-3s, again, really important. They're really important for cell membrane development. So long ago, there was a study that showed that women who lived in the Faroe Islands, which are out in the North Sea, had babies that had a significantly higher intelligence quotients and had better vision than babies that were born in mainland Denmark. And the only thing the investigators could attribute that to is the fact that in the Faroe Islands, if you don't eat fatty fish like herring, you're not eating because it's super expensive to eat anything else. It's sort of like, going to Hawaii and seeing that milk is $8 a gallon. So that was an interesting thing. Also, the investigators found that when those families moved back into mainland Denmark, resumed eating more of a Western type, high mammal fat, high junk food diet, that their next kids were less intelligent, and they were at a higher risk of being born prematurely, which is probably a lot of that, and higher rates of preeclampsia. So where the omega-3s hit the road for males is, you got to have those omega-3s to be able to make sperm. You got to make a lot of sperm. People are always saying, oh, it only takes just one. No, it's millions per ejaculate that need to be produced. And you can make millions per ejaculate if you have the right fuel and the right building blocks to do it. So again, the kings of omega-3 fatty acids, sardines. It's hard to find, anchovies that are whole anchovies, but if you can find whole tinned anchovies, not just the little fillets that are super salted and meant to put in like Caesar salad, but those are also really super high in omega-3 fatty acids. And you want to shoot for somewhere around a gram or more of those omega-3 fatty acids, especially the DHA version, docosahexaenoic acid. That's the most important one. Interestingly, that also lowers heart disease risk, helps with your high density lipoprotein production, lowers triglycerides. So eat those fatty fish. And honestly, I would eat a tin of sardines, most days a week, or 4 ounces of salmon. Even canned salmon is perfectly fine, but the sardines have more coenzyme Q10 and more omega-3 fatty acid than even the salmon does. Speaking of coenzyme Q10, it's another really profound antioxidant. We make it, we get it in our food. Unfortunately, over time, our diets have less of it in there. So if you go back and you read about what people used to eat, and I have just finished a couple of books recently. One about Sandra Day O'Connor and her growing up on a ranch in eastern Arizona, which is excellent. It's called The Lazy Bee. And another one that was about life in here in Tucson before the turn of the century, straddling the turn of the century, called These Is My Words. Both of those will show you that people were eating, when they slaughtered an animal, they ate the whole thing. So this whole thing of, we don't eat liver, where that came from is that when the ranchers figured out that, when the distributors figured out that you could get a steer to slaughter weight so much faster by feeding him corn, about twice as fast, what happens is those steers all have abscesses in their liver because they all get gastric ulcers from that corn-based diet. So those animals then, that liver is just full of pus. So they just throw them away. So being able to find liver you don't see liver in the store anymore. So a lot of people now are just they're not used to eating it. They don't know how to make it. They, find it completely repellent. But, people used to eat a lot of organ meat. The other thing that, has lots of CoQ10 are those small fishes and things. And so anyway, eat your organ meats if you want, but make sure that they're from grass-fed animals only, please. And go as organic as you can, because, I don't trust any of these food producers farther than I can throw them. There's all these preservatives. There's one called propionic acid that's now strongly associated with autism in animals. That's in all these bakery products that bagged bread that has preservatives in it in the grocery store. So just stay away from all of that stuff. Eat your whole food, eat your eggs for breakfast with leafy greens. Also and this may be more important on the female side than the male side, but the whole idea of our biome, the health of our bacteria in our intestines and on our surfaces needing to be as good as it can be is very, very important. So I would encourage you to eat kimchi or active culture sauerkraut every single day. And if you can, maybe 2-3 tablespoons of that. I think kimchi with underneath soft-boiled eggs is dynamite. Sauerkraut in sandwiches is nice, crunchy counterpoint. It takes sometimes, for people who haven't been used to eating it, it can take a while for them to get used to it. But those pickled vegetables with active cultures have an enormous amount of different lactobacillus species that actually can stick in you. And those pickled vegetables give those bacteria a place to hide as they transit through the stomach. So people are always saying, well, can't I just take a probiotic? And the bottom line is, well, okay, you just dump this capsule into your stomach, it dissolves, the stomach acid just kills all the bacteria. I mean, what are you doing? You're just wasting money. So you might as well just either make your own kimchi or sauerkraut or buy it. And any of the Whole Foods, Sprouts, here in Tucson, Time Market makes their own, and they make a really good sauerkraut. But eat those pickled vegetables, I implore you, for both of you. They're very important for mood and behavior as well, and especially if you're a guy who's had depression, just retooling your nutrition can make a gigantic difference in your depression. That in turn then leads to better sleep leads to weight loss leads to better testosterone production, better sperm function, and the whole thing. Oh, and also, as far as, we're talking about sleep, don't stay up all night watching video games. What the heck? I mean, yeah, they're fun. Red Dead Redemption's really fun, but come on, go to bed, get at least 8 hours of sleep. Please don't sit there and look at your phone all night, and make sure you're getting at least what you need. And what I always say is that if you were on vacation in a really nice bed, it was perfectly comfortable, and you slept 8 hours, you really probably need to sleep about 8, at least 7 at home most days. If on vacation you sleep 9 hours, you probably need 8 hours of sleep a night. So make sure you get plenty of sleep, and that goes for both of you. If you snore, please tell your doctor about it. Get a sleep study, because I guarantee you, if you've got sleep apnea and you've got lower sperm counts, which is almost always the case, you will be improved with your sperm counts will come up with better sleep, better rest, and better nutrition. So we covered those questions, and then we've got a patient is asking, will InvoCell work with lower motility and morphology? And the answer is, I don't know. I'm going to look it up here and see what this is. Okay, so it's an intravaginal culture for IVF. So the bottom line is IVF is always a good treatment for severe male factor infertility, but so the answer would be yes. It's if you're just culturing eggs and sperm together, and then you're kind of incubating the vial yourself, then it's a little bit more of a random deal, because traditionally with severe male factor infertility over the last couple of decades, we just inject the sperm into the eggs. So doing intravaginal culture and seeing what's happening, and then just taking out the vial at day 3 or whatever and seeing if you've got fertilization and embryo development is a little bit of a crapshoot. But, hey, it's pretty cost effective. And if it's in your area and you want to give it a try, I would encourage you. Younger eggs also can repair some of the DNA damage to older sperm or sperm that have been kind of abused. So keep that in mind. So, younger female partner can make up the difference for older or sicker male partner. But again, before you go to IVF, I would strive to make your sperm as good as you can, because I kind of view the sperm as sort of like the canary in the coal mine. If you're actually having some issue with sperm production, there may be something else going on metabolically with you that's going to hurt you down the road and maybe increase your risk of diabetes and cancer and heart disease and all kinds of stuff. So definitely try to work on as best you can. What else was I going to? Oh, somebody, I think they were asking about the family fiesta thing. I think if you've been, one of our former patients even, go ahead and register. That'd be great. But anyway, if anybody has any other questions, feel free to ask me, because I think I'm about done. No energy drinks. Those energy drinks are evil. We were at this meeting I was at about a month ago. We were having, a bunch of us reproductive endocrinologists were having lunch, and we were discussing how it's almost impossible to see a guy who drinks like those Rockstars, Red Bulls, Monsters, all those things, and have a normal semen analysis. So my suspicion is it's probably because they kind of get addictive, and then they're drinking them all day long, and then it probably is disrupting their sleep at night just because there's so much caffeine in them. But who knows? There's also a gamish of different chemicals in those things, and I think it's best to stay away from those. there's it was Center for Science and Public Interest has a good website on caffeine content of various beverages. And I would encourage you to look that up. One of the energy drinks, and I can't remember the name of it now, had like 450 milligrams of caffeine. I mean, I'd kill a horse. I mean, what are we doing? This is nonsense. Anyway, but if that's all that, if no one has any other questions, then we'll be finished with male factor. And be sure to, you can give us other questions on other ones if you think of them down the road. And then we will see you in a couple of nights here. So thanks for joining us for Hutchison's Huddle here at Reproductive Health Center. Thanks.